Thanks very much to Michael, to the PM, but especially to Bridge. Bridge is somebody with immense courage. I mean, to face what she has faced in her life and to turn this into a passionate career. There's not a person in Australia who doesn't face themselves or through their friends or their families mental health challenges. Some of you in this room have shared with me your journeys, and I know how hard they have been. And so, as a country, we are evolving in not just our treatment, but our recognition around the stigma of mental health. And what Penny said to us, one word, recovery. And today is about hope and recovery. And so this journey is about recognition, but it's about support. What we've been able to do, and I, like the PM, want to acknowledge David Coleman for his work, is strike agreements with every state and territory. On the eve of an election, being able to do that, I think, speaks to the partnership that we've been able to build, and it's a credit to every state and territory as well. You know, in particular, Michael and Jeremy here, but around the country, people such as Amber Jade Sanderson in Western Australia, the work we've been able to do with people across all of the different parties right around the country. So those agreements together are part of the broader long-term national mental health and suicide prevention plan. It's a $3 billion plan. These agreements with every state and territory will deliver Head to Health for adults, Headspace for youth, and extraordinarily Head to Health kids for under 12s. And a lot of emerging issues are created in those primary school years, and something we've really, as a country, not acknowledged before. So this agreement completes that process. Every state and territory working with the Commonwealth in partnership to protect mental health. 70 Head to Health centres around the country, 164 Headspace centres, and now 15 kids Head to Health centres. And these will save lives and protect lives. I have no doubt about that. And we heard it this morning. You've heard from Penny and Lisa, who were so courageous. But before you came, I was talking with Katrina at the front desk, and Katrina sort of said, sorry, I have to take a client call. And she worked with somebody on their issues. And as Bridget said, over 400 since it started, 50 in the last week. Word is getting out. People are coming to help themselves. And that's why these agreements are so important. Michael and the PM have set out what this agreement means for Tasmania. But in addition to that, specialised eating disorder clinics in the northeast, in the northwest and in the south. In addition to that, the support for perinatal mental health. And then, of course, what we have is the biggest lifesaver potentially is universal aftercare for those people who have attempted suicide. That is their most vulnerable moment. And this agreement embeds funding so as every person who is recovering from having attempted to take their life will have the support to protect them. I just want to say this. Through this journey, I could not have had stronger support than from the PM. It was pushing on an open door. And his test was always one. He said, what's going to save lives? And Head to Health kids and aftercare were the things that he identified along with eating disorders. And to have that support has been an absolute privilege.